Diabetes greatly increases your risk of developing severe foot problems. This film is intended to help you reduce that risk.
To try and prevent diabetic complications as a whole, we would always try and get blood glucose control as tight as we possibly can. It's really important that people don't smoke because that affects the small blood vessels and that puts you more at risk of ulceration and breakdown in the skin. They also need to make sure that they manage their diet effectively and exercise as much as they can. In people with neuropathy and ischemia, sometimes that can be difficult because their mobility is reduced, but exercise is a very good way of improving diabetes control.
Neuropathy is a condition in which you lose sensation in your feet. This can affect what your feet are able to feel and your mobility.
A lot of people, for instance, if they lose a filling in their teeth, would go to the dentist if they had pain. If you lose a filling and you don't have pain, then you tend to ignore it. And people can do that with neuropathy as well.
Ischemia is when your feet do not get an adequate blood supply and so lack vital oxygen and nutrients. This can eventually lead to skin and tissue death.
First of all, we would always suggest that they wash their feet daily in warm, soapy water. Make sure that the water's not too hot. If people have got neuropathy, then checking the temperature, either with a thermometer or with their elbow, is important. People can get some nasty burns from putting their feet in water that's too hot. It's really important that people dry very carefully their feet, especially between the toes, because again, you don't want them to get soggy. Always moisturise areas of dry skin. Would suggest that people moisturise on a daily basis. I usually tell people at night when they get into bed to just moisturise their feet. Ladies in particular are very good at moisturising their legs, but they never go any further down than their ankle. And heels can crack quite easily, particularly in summer when people wear sandals. We wouldn't really advise it to be between the toes though. So what can happen is that the areas can get soggy and that can then break down and lead to a centre for infection to take place. The next thing to do is to make sure that when you cut the nails, that you cut them following the shape of the toe and file them smooth. Make sure that there are no jagged edges.
You should always change your socks regularly. Natural fibres such as wool or cotton are best.
Always make sure that your shoes fit really well, and if possible, make sure that you have them measured, because if you do have neuropathy, you may try on a pair of shoes and think that they fit perfectly well, but in fact they don't.
It is important to check the inside of your shoes for prominent seams before you put them on.
And the most important thing is that if you notice any problem whatsoever, no matter how small or insignificant it might seem, that you get that checked out, and it needs to be seen that day. Changes can go wrong very, very quickly, and nobody would mind looking at a foot and saying, well, no, we think that's okay. We'd much rather do that than something go terribly wrong.
Whether you appear to have a problem or not, an annual checkup is essential. Not only can professional clinicians answer your questions, they can also spot problems you may have missed. You will usually see a specialist nurse who will make a variety of checks. These include a general overview of the condition of your feet, a vascular check which tests the condition of the blood vessels in your feet, and a neurological check. The nurse will then provide advice designed to meet the needs of you and your feet. If you have diabetes, your feet can deteriorate quickly, and it is sobering to realise that diabetes is the largest cause of foot and lower leg amputation outside of trauma. One particularly important way of lowering that risk is choosing the right footwear.
For a diabetic patient, footwear is very important because poor fitting footwear causes a huge number of ulcers. The vast majority, I think, of male shoes are usually okay. As long as we don't have seams in any areas that are very prominent, they should be okay. Shoes for women are a bit more problematic. Basically, the lower the heel, the better. A standard heel height of about 2.5 centimetres is usually ideal. The problem we have is the higher the heel, the more pressure we have over the forefoot. Furthermore, if we have a narrow heel, Then we introduce instability to the ankle, and this can alter gait, and any alteration to gait can result in ulceration through adjusted pressures. If we are going to do your own footwear for you, we have to look at a few different things. Now, the shoes basically need to be either Velcro or lace-up. They're more adjustable and you need to get quite a precise fit.
Yeah.
A shoe that's a slip-on is usually, it has to be inherently tight or it falls off your foot, so usually we find that gives people excessive pressure. As regards the soles of the shoes, we need them to be fairly broad at the heel, nothing too narrow and nothing too high. The higher the heel is, the more pressure we have on the forefoot, and it tends to be the forefoot which ulcerates most commonly.
Yeah.
The material, I think, needs to be fairly soft, so the trainers you've got are fine. Leather's always quite good. Trainers are better than people often think. What we do need to be careful of is any seams that sit over any areas that are very prominent. So if your toes are clawed, as a lot of people's are with diabetes, we need to watch seams across the top. We need them to be padded, the shoes, as well, so we need quite a thick tongue and also a padded collar like this shoe. So it sits just below your ankle and we don't get any breakdown there.
Yeah.
Well, once we have a patient who's in stock footwear, then the studies have shown that we can reduce their chances of re-ulcerating by 50%. So you just put your weight on here, you're not trying to stamp through it or stand on the surface, you just have to put your foot on it as gradually as you can, okay? Lift your foot up. Now, if you just put your foot down there, okay? All the way down. That's absolutely fine.
Getting your feet measured is very straightforward. It is also vital in finding exactly the right insoles and shoe size for you.
I think over the years we've had some problems with patients complying with the treatment of wearing the shoes. The difficulty, I think, has always been that they've worn shoes which haven't been very attractive, but nowadays we give patients a lot more choice of style and colour. Not all patients need to have footwear provided by us just because they're diabetic. If a patient's neuropathic or has vascular disease, then they definitely need to come to us. Also, if they have a lot of deformity, then they need to come to us. But if a patient doesn't have these problems, then they can provide their own footwear.
Along with the things that we recommend that people do, there are also some things that we recommend that people don't do. We would recommend that people don't try and treat any foot problem themselves. We do see people who have tried to cut hard skin off with Stanley knives and that kind of thing. And corns, the corn plasters that people can get can be quite acidic and can cause some really nasty burns. If you do have corns, then it's worth getting them treated properly by a podiatrist. Because people with neuropathy have lost the sensation in their feet, they don't feel things that are particularly hot. So they don't feel hot bath water, they don't feel if they were getting burnt from sitting too close to the fire, and they don't feel the burning that they can get from hot water bottles. And I have seen some really nasty burns on the soles of people's feet from having them on hot water bottles. In winter, if you do need to use a hot water bottle, you should always take it out of the bed before you get in. And don't ignore any problem whatsoever. The most important thing is to seek assistance from somebody who is a professional and can give you the correct advice.
I'm diabetic. I've been diabetic since 1988 and I've got neuropathic diabetic feet. My feet don't sweat, so my feet don't get any moisture to them, and because of that I get hard skin which cracks and causes ulcers more easily. I couldn't be living the life that I'm living now without the diabetic centre and the footwear that they make for me. It's changed my life really. I mean, yes, I know that I'm always going to have these problems and it's something that I've got to live with, but if I do get any problems, they're there and it's sorted straight away. It's not a lingering process.